What you'll learn about today on the webinar. We'll talk about the connection between climate change, physical and mental, as well as community health, and hear from a variety of guest speakers throughout the series over the next 3 months on what is being done across Atlantic Canada to help address these impacts. And as we dive into this presentation and Q&A, a reminder that climate change and its impacts can affect our mental health and overall wellness. We have compiled a non-comprehensive list of some resources related to eco-anxiety that we will send in the chat if you would like to explore that list. And today we have a wonderful speaker. I'm so grateful to be able to welcome Melanie Langille, the president and CEO of NB Lung, who is going to speak today about their organization and the connections between climate change and respiratory health. So with that, I will pass it over to Melanie.
Well, thank you, Anna, for that warm welcome. And thank you. Sorry if I'm muted there. There we go. So thank you very much for that warm welcome, and thank you to the Climate Atlantic team for reaching out and inviting me to speak today as part of this webinar series. There we go. So this is the title of my talk today. We're going to talk about climate adaptation from a lung health perspective, which may be something that's maybe not apparent or readily obvious when we think about climate change, the impacts that it has on our respiratory health. But we'll try to walk through that together and connect those dots for you. So if you're not familiar with NB Lung, we are the provincial lung health charity here in New Brunswick. We've been here since 1933, focused on providing supports to patients currently living with lung disease, public education, and working in the area of protecting the air that we all share. So that's really the crux of what we'll be talking about today. And there's my team of champions behind me there in the photo. So a little bit about myself. Sorry for the outdated picture. I cut all my hair off a month or two ago and obviously haven't taken a photo in the interim. But I am the president and CEO here at NB Lung. My background is really rather technical as an environmental scientist. And before I came to the NGO world, I worked a lot in engineering consulting in the areas of human health risk assessment, particularly specialized on the vapor phase of contaminants and how that impacts human health and environmental impact as well. Here at NB Lung, I've been here for 6 years plus. So I represent our mission in a number of working groups across the country, including, there's a lot of acronyms here, folks, and I'm sorry. The CCME is the Canadian Council of Ministers of the Environment. AQMS is the Air Quality Management System. They had a technical working group that I was part of. The National Pollutant Release Inventory. There's a stakeholder working group that I'm part of there, and also here in New Brunswick on the stakeholders list for all of the updates in the air quality space. But all that to say, I come at all of these topics from a very equity driven lens and a data driven decision making type of background as well. So let's talk about lungs. Lung health in New Brunswick. It's actually 1 in 5 New Brunswickers live with lung disease. That's a lot. That's a pretty high proportion. So chances are, with 50 people on the call here, statistically, 10 of you probably are living with lung disease, or you may live with somebody who has COPD, chronic obstructive pulmonary disease, or asthma, or a number of other lung health conditions that some are more rare than others. And we know that exacerbations or worsening of symptoms of COPD is the second leading cause of hospitalizations in this province, second only to childbirth. So that's a lot of hospital visits are related to a worsening of COPD symptoms, exacerbations of COPD symptoms. And in New Brunswick, we know that the leading cause of avoidable mortality is lung cancer. So there's an awful lot of reasons that we would want to be concerned about lung health and trying to move the needle on some of these numbers. And that's kind of our mission here at NB Lung. Oh, I think I may have advanced 2 slides. No, just one. Sorry, there's a little delay there. So how does air quality come into the conversation here? Well, here's some stats and facts from Health Canada. So in their most recent report, they've indicated that air pollution is one of the largest risk factors for Canadians in terms of premature death and disability. And they have attributed in their study over 17,000 premature deaths every year in Canada are attributed directly to air pollution. Now we calculate that through on a population basis. That's over 400 New Brunswickers every year that are dying prematurely due to exposure to air pollution. And that is likely a huge underestimate because that study is limited to 3 particular contaminants in the air that we'll talk about later, and only outdoor air. We also know that, pulling it back, we're not just worried about premature deaths, we're worried about impacts on human beings on a day-to-day basis. On a Canada-wide basis, over 3.6 million asthma symptom days and 39 million acute respiratory symptom days. Now that might look like someone who is so unwell from the respiratory symptoms that they can't get out of bed that day, they can't go to work that day, they can't take their kid to school that day. It's a big deal. And the economic value of that, if you're a dollars person, is over 135 billion every year in Canada. So calculate that through again, about 2 billion in New Brunswick. Asterisk there, because that's also likely a huge underestimate that is based only on the economic loss due to premature deaths and doesn't include the cost to treat those non-fatal endpoints, those COPD exacerbations, those folks landing in the hospital due to the exacerbation of their symptoms. And the World Health Organization articulates this very succinctly. Air pollution is the biggest environmental risk to human health. Now, exposure to air pollution, what does that look like? Short-term exposures, if we have a bad day here in New Brunswick, maybe we've got some wildfire smoke from a fire here in the province, or maybe further away, or maybe we're talking about air pollution from an industrial facility. Short-term exposures look like some throat irritations, maybe some shortness of breath, and exacerbations of those existing lung conditions. So again, if you live with asthma, you live with COPD, it may become very hard to manage, even with a short-term exposure to high levels of pollution. But the longer you're exposed to pollution, the worse the story gets. We have development and worsening of asthma symptoms. It can lead to bronchitis. It can lead to chronic obstructive pulmonary disease. It can lead to heart disease and hypertension. And really, the crux of this is there's no safe level of exposure to air pollution, so we really need to do everything we can to minimize it. Health Canada also indicates that the following list of folks are at increased risk, not just what we talked about in the last slide, but even worse for these populations. This is a pretty comprehensive list. Seniors, pregnant people, infants and young children, people who work outdoors, people involved in strenuous outdoor exercise, and people with existing or chronic illnesses and health conditions like cancer, diabetes, mental illness, lung or heart conditions. I would also add to this list the unhoused population, as they have no limited capacity to have respite from poor air quality days. So there we go. So really, this list pretty much covers most people in the Atlantic region. So I think many of us would slot ourselves into one of those categories. So it's really, it touches most families. Excuse me. So where does air pollution come from? We can kind of get into this mindset of, well, our air looks clean in Atlantic Canada, and really we do have some of the best air quality in Canada. However, just because you can't see it doesn't mean it's not there. And just because our air might be cleaner than places like, for example, some of our very highly dense, densely, highly populated areas of the world with a lot of industry. You see some pictures on the news of very hazy skies. That's very, very dangerous, but that doesn't mean that our seemingly clear looking air is without its health risks. So air pollution is created or is generated by lots of things, including the transportation sector, particularly when we're burning fossil fuels to get from point A to point B. When we're generating electricity, again, using fossil fuels. Even industries like metal refining and the cement industry, combustion of anything, you burn anything, it puts stuff into the air. Wildfires, another one. And it's not just what's happening in your community. This can move from hundreds of kilometers away into the air that you're breathing. It can move from other provinces. In New Brunswick, we're adjacent to the United States. We can have transboundary movement of that contamination from one country into another. And again, there's no safe level of exposure here. But we're going to focus the rest of this conversation on three particular contaminants that are most linked to health risk, which is nitrogen dioxide, ground level ozone, and PM 2.5, which is fine particulate matter, which gets special mention. So we'll dig into that. Fine particulate matter, the PM 2.5, is particles in the air that have a diameter less than 2.5 microns across. So very, very small. This image on the right kind of gives you an indication of what that looks like compared to things like beach sand. So the PM 2.5, if you can't quite see the captions there, it's the little tiny red dots. So beach sand compared to human hair, compared to the blue dots are PM 10, that's particulate matter less than 10 microns, and the PM 2.5 is even smaller than that. Now this comes from forest fires. Pollen sometimes falls into this category depending on the size of the grain. Wood burning of any sort, whether that's wildfires or wood stoves or furnaces, campfires, construction can create a lot of PM 2.5, agriculture as well. And particularly, again, fossil fuel combustion from things like traffic, things like heating, things like electricity generation. And again, this can move. It can either be emitted in a local area or it can be moved around quite easily over long, long distances. Now, the body is used to filtering out foreign particles, but PM 2.5 is so small that it kind of gets past the body's natural defense system. The little hairs in your nose can't see this stuff. It's too small. So it can get inside. It can get deep inside the lungs. And almost like a splinter inside your lungs, it causes inflammation. It can cause that inflammation throughout the body, throughout the circulatory system, and just keeps that the more inflammation you have in the body, the more the health impacts start to stack up. So that's pretty dire. And our changing climate is overall reducing our air quality. Let's talk about why. A bit of a busy graphic to have this here in both languages. The link is there. You're welcome to dig into this. It's a really great report, Health of Canadians in a Changing Climate. So climate change affects the way that Canadians are exposed to air pollution. Lots of nuances and details on this slide, but the elevator pitch for this concept is that as our air is hotter and more humid, it's heavier. And so that air pollution that is being emitted out into the atmosphere gets stuck. And those pollutants stay closer to the surface of the earth than they would have under other climate conditions where they can kind of go up a little bit further, disperse, and we're not breathing them so much. But we're kind of keeping all that pollution is stuck close to the earth, so we're breathing more of it. Hot and humid conditions are also a challenge if you're already living with lung disease. So hot and humid plus increased air pollution is a bit of a double whammy on the respiratory system and can lead to a number of health incomes, cardiovascular disease, premature death, lung cancer, exacerbation of those lung symptoms, heart symptoms as well. In the climate change space, we often talk about mitigation and adaptation. So the air quality addition of climate mitigation really looks like reducing that air pollution overall, especially the air pollutants that are termed climate forcing agents. So you're probably aware of greenhouse gases as a climate forcing agent. The more greenhouse gases we have, the more it exacerbates that warming and that holding, that heavy humid air that's stuck near the surface of the earth. But PM 2.5 also falls into that bucket as a climate forcing agent. Um, in order to mitigate this problem, it's going to take a whole of society approach and recognizing the health impacts of policies and decisions that are related to energy, that are related to transportation and industrial development. And because these connections are not immediately obvious, the health angle has for many years not been included in these energy policies, transportation policies, industrial development policies, and so on. But I'd like to spend more time today talking about the adaptation side. So air quality addition of climate adaptation. What does that look like? How can we protect our lungs? How can we protect folks that are, the 1 in 5 of us that are living with lung disease? First step is to know that just because the air looks good doesn't mean it's necessarily good. Unless you have microscopes for eyeballs, you can't see the PM 2.5 in the air. So there is a handy tool called the AQHI, which is the Air Quality Health Index, which has been developed for many, many years. And NB Lung representatives before my time were part of the committees that worked with Health Canada and Environment Canada to develop this scale. It's a scale from 1 to 10 that indicates whether the air is showing, low to high risk of health impacts. And well, now we are talking about 10 plus, because in wildfire events, even the 10 is not accurately representing what that health risk is. And so just like you would check the UV index before you plan your outdoor activities, I would suggest that you also check the AQHI to plan your activities. Pardon me. And now we do have this color coding where, from blue to red that shows, lowest impact to highest impact, but everybody's different. Every set of lungs reacts a little bit differently to air. So we want to hit home the message that if you're living with a lung condition, to know the number that you feel the impacts at. So personally, I have very mild asthma. I notice when the AQHI is like at 3, an increase in my symptoms. So I can only imagine that that folks with a more severe lung condition would be feeling that, even in the low to moderate risk range. You can access the AQHI. It's part of the weather forecast that's published by Environment Canada. It doesn't seem to be universally included into weather forecasts across, whether you use the Weather Network or whatever type of weather app that you use. But on the WeatherCan app, it is the most obvious. It shows you not just what the air is like right now, but it also gives you a forecast for the next couple of days. So if you're planning, if you live with lung conditions and you're trying to plan your outdoor exercise, you may see that tomorrow's not looking so good, but maybe the next day will be better for those activities. And now the AQHI is based on the current and predicted levels of PM 2.5, nitrogen dioxide, and ground level ozone, the ones that have the most health impact out of the stuff that's in the air. There's a whole myriad of stuff in the air at any given time. There's a recent update to the WeatherCan app where you can actually set push notifications for yourself. So you can say my number, and I've done this, my number is 3. I want to know when the AQHI is or is forecasted to be greater than 3 so that I can plan my activities. And it's important to know that those air quality health index forecasts are based on the air quality that is measured and the models of how the air is moving across 6 NAPS stations across New Brunswick. And NAPS is the National Air Pollutant Surveillance System. we'll get into that as well. So there's only 6, which there could be more. It would be nice if there was more. So several years ago, Environment Canada started piloting a project to get more air quality sensors across the region. Now there's only 6 because the NAP stations are very sophisticated instruments and a very high price tag. So to try to densify that network is really not feasible at this time. But there are relatively low cost sensors out there. And what we focused on was PM 2.5 because it is one of the major drivers of health impacts. And it's also the one that seems to be the most variable. So Environment Canada ground truthed a number of different models of these lower cost sensors. MBLM was part of a pilot project to bring these into New Brunswick. So you can see on the map here, I don't know if you can see my cursor, but the diamonds, there's 6 diamonds in New Brunswick. That's the NAP stations. Thank you, whoever's doing cursoring for me. And the circles are these low cost sensors. The brand is Purple Air. I don't know why it's purple, but that's what it is. And this map has been developed with the University of Northern British Columbia in collaboration with Environment and Climate Change Canada to adjust the Purple Air raw data so that we're comparing apples to apples between Purple Air and NAP. So it's a very cool map. And those sensors collect data and report it in almost real time. So they're 10-minute averages. I grabbed a little snapshot of one of the Purple Airs that's up in the Heartland area. So you can see every 10 minutes you're getting a little snapshot of what the PM 2.5 concentration is like in that area. So very cool. This enables the air quality health forecasters to, when there is, for example, a wildfire event, they can use the Purple Air network to complement the NAPS stations, the 6 stations across the province, to really pinpoint where the health messaging needs to be most strong. On an individual perspective, from an air quality and climate change, we need to be aware that our climate is changing. The wildfire situation is something that, when I was growing up here in New Brunswick, I think I can count on one hand the number of wildfire smoke events that I can remember. Actually, one finger, 1992. But now it's becoming more and more common. 2025 and also 2023 were record-breaking wildfire years. Not great that we're having record-breaking so close together. But really indicative that we have more and more frequent, more intense, longer duration threats to air quality. So I would like to recommend that everybody, if you're making a 72-hour emergency kit for your family, that you include an N95 mask. In that, they are very effective in filtering out that fine particulate matter and protecting your lungs. And also, if you're doing your emergency planning, think about the air that you're breathing. So plan to spend some time in clean air spaces to give your body a break from fighting off all of those particles. In a perfect world, everybody has an HVAC system with HEPA filters that they can turn on to recirculate. But we know that that's not the reality for everybody in this region. There are other ways to protect the air in your home. So there's lots of ways that you can do it yourself, make an air cleaner out of a box fan and furnace filters. So we made a little video here, a couple of summer students here that had built a Corsi Rosenthal box, which is 4 or 5 filters with a box fan, very effective. And there are other ways to do that as well. There are limitations to them. You don't want to be using them all the time, but they can help create some clean air inside your home. We also suggest folks that if it is very smoky and they don't have a way to create a bit of a clean air space in their home, that you can spend time in a mall or a library that probably has a pretty robust HVAC system, and you can, again, give your body a bit of a break. I do like to emphasize that municipalities, when they're doing their emergency planning, that we include something like clean air shelters, similar to what we do in the cold, warming centers. We also often use those same locations as cooling shelters, particularly for the unhoused population in our communities. This can be really, really important. In the event that we do have a poor air quality day, on top of having that in your plan, how are you going to protect your air? Ways that you can reduce your risk is to limit your time outdoors, limit the intensity of your activities outdoors. If you have to, if you're walking to get to work, give yourself a little extra time so you're not huffing it and breathing really heavily. Just reduce that intensity will reduce your exposure. Um, if you're able to keep your windows and doors closed without turning your home into an oven, that's really effective as well. If doing so is going to make it unsafely hot, you do need to prioritize cooling. And if your own residence is not someplace that you can make into a clean air space, seek out those places where you can have a little break, go to the movies and breathe some clean air for a bit and give your body a break. It's super important also to check in on loved ones. Not everybody is aware of these connections between lung health and cardiovascular exacerbations and poor air quality events. So if you have someone in your life that falls into that category, when we have a smoky event, we have some air quality alerts out, go ahead and give them a call, especially if they fall into that category of more vulnerable or special considerations under Health Canada, which is almost all of us. These are conversations that need to be had and turned into sort of your regular kitchen table conversations and not just limited to a webinar like this. Again, if you have to go outside during a poor air quality event, some of these things I already touched on, but so for some folks that work outdoors, this can be particularly hazardous. So we want to reduce that physical activity, wear the N95 mask, staying hydrated. You might not seem to have a connection between lung health and drinking water, but it does. It helps your body to eliminate all those particles and to kind of give it a break when it's working so hard to fight off those intruding particles. And don't ignore it. So we've had folks that didn't know they had asthma, for example, until they experienced a wildfire event and they were trying to just push through it, when really we need to start slowing down. If we're experiencing lung or heart conditions, put the brakes on. That's when it's time to seek some medical attention. So from a lung health perspective, climate change is a pretty big deal. And MB Lung has been working at the interface of air quality and lung health for many years, 20 plus. Some of our current objectives and activities are engaging some citizen scientists in air quality measurement. So all the purple air, the little circles on that map that I showed you earlier, all of those hosts have been part of our pilot project here at MB Lung, and we do sometimes have a small inventory of PM 2.5 sensors that are looking for new homes. So if you are a data geek and interested in hosting a PM 2.5 sensor, give us a shout. Just takes a plug and a Wi-Fi connection, and then it's pretty much hands off. We do run a awareness day the first Wednesday of June nationally as Clean Air Day. The last several years, we've run the national awareness campaign for Clean Air Day. So mark calendars, June 3rd this year, or 2026. We do have some pretty cool plans for Clean Air Day that are pending funding. So please stay tuned for that. But we're also working a lot in the areas of clean energy transition. The sooner we can get off of fossil fuels to generate our energy, the sooner we can clean up our air and the better our lung health outcomes will be. So we also work in the policy space as well. So we provide technical expertise and recommendations to policymakers. We gather and share public support. We've got a number of petitions or letter writing campaigns on our website. So if this topic does speak to your heart, I do encourage you to participate in that. And I think I have some links here in a second. Yeah, there you go. So on our site at mblung.ca/advocacy, we've got a couple of opportunities for you to engage with your elected official on the links between health, lung health in particular, and these energy policies. We have lots of air quality resources on our website. So please take some time, dig through there. A wealth of information there from a team that's pretty motivated to do this stuff. I also encourage you to join our newsletter. But once a month, we send some cool stuff, some information about what we're up to and how we're working in this space that's connecting air quality and health. And also on your social media platform of choice, you will probably find us there as well. Excuse me. So to recap, the climate crisis is also a health crisis, especially for the disproportionately vulnerable people in our communities, which is a lot of us. A lot of us are vulnerable to poor air quality. Individuals on all levels of government can prepare for poor air quality events that are, it's becoming our new normal to have these massive wildfires across our region and have some poor air quality days in our communities. So it needs to be incorporated into our emergency planning. And really mitigation of this risk involves an all of society transition to green energy overall. And that is the end of my slideshow. I know we're going to transition here for a second, then come back to questions, I do believe is the plan. So thank you so much for listening to me and happy to take any questions when it becomes appropriate.
Awesome. Thank you so much, Melanie. That was wonderful. I learned a lot, and it was really great to hear from you and all of your expertise on that topic. Before we jump into the Q&A, this will give you a little bit of time to think about questions. I'm going to hand it over to my colleague Jenna to speak about the New Brunswick Climate Change Risk Assessment. So over to you, Jenna.
Thank you, Anna. Like Anna mentioned, I work with Climate Atlantic as the New Brunswick Provincial Climate Services Specialist, but I also work with the Government of New Brunswick's Department of Environment and Local Government on their climate change adaptation team. So this is just a little public service announcement that New Brunswick has just completed our first province-wide climate change risk assessment. It's expected to be publicly released early in the new year. So you can look forward to that. A climate change risk assessment of this scale was a commitment in our climate change action plan. And climate change risk assessments are a valuable tool that can be used to identify which climate hazards pose the greatest risk to society and to better understand who and what is most vulnerable to these risks, and additionally to support evidence-based planning and decision making. So GNB's climate change risk assessment was informed by input from over 275 participants, including different GNB departments and agencies, stakeholder and community groups, including health partners and environmental nonprofits, and climate scientists. The findings are meant to inform future planning, policy, and community preparedness across provincial government, local governments and sectors, and health partners. The climate change risk assessment looked at 11 different climate hazards grouped under these 5 categories. Specific hazards include flooding, drought, high winds and storms, freezing rain and ice storms, coastal flooding and erosion, extreme heat, changing seasonality, and freeze-thaw patterns. The assessment uses 5 province-wide focus areas that represent different sectors or systems across the province, including public health and safety, natural environment, communities, economic activities and livelihoods, and physical infrastructure. In order to determine risks, we look at how likely each of the hazards from the previous slide are to occur over time, and what the consequences of those impacts will be for each of these 5 focus areas. And Melanie, your presentation was wonderful. I think you've already covered everything that we have in this slide. But in general, what you'll see in terms of respiratory health in that has come up in the climate change risk assessment are that increased wildfire events with wildfire smoke will become a more common concern, contributing to poorer air quality and more days when sensitive groups are at risk. We also are expecting more extreme heat days, which can worsen respiratory and cardiovascular conditions, especially for seniors and people with chronic illnesses. And longer pollen seasons and increased allergens from ongoing warming may lead to more severe allergy and asthma symptoms. Overall, the assessment is designed to help health partners anticipate who is most at risk and where efforts are needed to improve climate resilience in the health sector. So yeah, New Brunswick's climate change risk assessment will be released sometime early in the new year. And thanks for listening.
Thanks so much, Jenna. That was great. Um,